Hi everyone, this is Ishika Kesarwani and I welcome you all to the TechFit podcast. Today we are having Kunal Kishore Dhawan with us. He's the co-founder and CEO of Navia Life Care. Thank you,
Yeah,
sir,
hi.
for joining us. Can
Thank you
you
so much.
first start with introducing yourself to the listeners?
Sure. So my name is Kunal. I am the co-founder and CEO at Navia Life Care. Uh, I come with a background of healthcare and pharmaceutical companies with about 10 years experience working in the industry. I hold a master's from Carnegie Mellon University in the US in the areas of biotechnology and management. And I also have a biochemistry undergraduate degree from University of Delhi. Uh, Post completing my post graduation, I worked for a couple of pharma companies in multiple geographies. I worked in Germany, I worked in India as well as in the US. And in 2016, got together with a couple of friends of mine to start off a digital health venture called Navia Life Care.
Great. Can you please tell us about a bit about Navia Life and the services provided?
So Navia is basically a digital health company trying to build India's largest healthcare transactions platform. We are a doctor focused organization building tools that help doctors improve the way they operate their clinics or their operations. We're an end to end clinic digitization system along with a financial outcome improvement system as well. So, broadly, Navya has two products that we are working closely with our customers for. The first product essentially digitizes the end-to-end clinical operations of a doctor or a clinic or a small to medium-sized hospital. It is centered around being able to write digital prescriptions and and of course has allied components such as video consultations, patient engagement, patient communication. So basically anything that helps doctors retain customers. More recently, we have embarked on introducing uh, a component of buy now pay later or BNPL in the healthcare ecosystem. So building on the network of doctors that we already have in the ecosystem, we have introduced this BNPL offering for patients specifically to opt for high ticket value procedures where insurance is not an option. So specifically things like a dermatological procedure or a dental procedure for which dental cover doesn't exist and do not involve any hospitalizations. Navia is able to extend short-term credit for these patients to avail these services, and this helps doctors one retain more patients. It also helps them plug in revenue leakages and therefore improve their financial outcomes. So overall, through the Navia Smart ecosystem that we aim to build, we are trying to improve both clinical as well as financial outcomes for both patients and doctors.
That is great. So, what exactly makes Navia Life unique from all the competitions that you have?
So broadly, we always talk about USPs and building business moats around businesses. So over the last 5 years or 6 years of our existence, we have tried to build business moats around our business as well. Today, we identify ourselves as a unique proposition of three different USPs. First of all is our secret sauce, which is sort of our trust moat. So we've been in the industry for almost 6 years now, and we've been working with multiple stakeholders in the healthcare ecosystem in India, and most of all with doctors. Because of our longevity and being able to service the needs of our users and customers, we are now known as a very trusted brand in the ecosystem. So, in the Indian healthcare context, trust is a very, very important factor. So, today, doctors as well as any other stakeholders in the ecosystem find it very easy for themselves to partner with Navya, knowing fully well that they are partnering with us for a long term, and that goes a long way. We have also ensured that all regulations are taken care of, all data security, privacy concerns are taken care of, so that anybody who partners with us knows that their data, etc., is completely secure. So trust factor has gone a long way in differentiating ourselves in the industry. The second is our business model mode. We are one of the few companies that are totally focused on helping doctors achieve modernization or introduce digitization in the doctor ecosystem. Most doctors find it very difficult to adopt technology, and we are taking as many steps as we can to make that transition very very easy for them. So, and because of which we end up sort of influencing a lot the key decision maker, which is the doctor in the ecosystem. So that is our second key USP. And third, of course, is our distribution and sort of network mode. So we are already working with 20,000 plus doctors, which makes up for around 2% of the Indian market today, which is one of the highest in the industry. Most doctors who try out our product do not end up leaving it. It's a very high stickiness and retained product for them. So, and we are actively growing our user base as we speak, looking to increase it by almost 10 times over the next 12 to 24 months. So that again will be a huge moat that any new company will have a very difficult time in approaching. So we believe that the combination of all three is critical for us to build India's largest healthcare transactions platform.
That is amazing. So, can you tell us a bit about how the healthcare sector works, a bit about the industries, and like what are the common myths in this industry which people usually have that you would like to
Um,
break?
so upfront, I think this is a separate conversation which can go on forever if you want to really learn about the Indian healthcare industry. But a couple of important points that I want to kind of highlight at this point in time. One, the use of technology has been very very minimum in the Indian healthcare industry, and it's been very very slow to adopt any kind of a uh, you know tech platform or anything. And that has primarily been because of the nature of the products that have been that have been released in the market. Secondly, it is a highly controlled industry and highly regulated industry for obvious reasons, but it is also highly centered around the key decision maker, which is a doctor. So broadly, doctors control a lot of decisions that happen within the ecosystem. You can just take your personal example if you want. Whenever a doctor writes something on a piece of paper in the form of a prescription, as a patient, you are likely to follow it. You're likely to follow it to the T. You will obviously go to the chemist and you'll ask for the same medicine that he has written, even if the pharmacist says that it's just a substitute, which is cheaper for you, but you're still likely to go for the same one or the same brand that he or she has the doctor has written. So similarly, doctors hold a lot of power in a lot of other decisions as well. They decide what kind of drugs are being prescribed. They decide what kind of tests are being prescribed, which directly impact the business outcomes of, say, pharma companies, directly impact business outcomes of pharmacies, labs, and many more. And doctors also find it extremely difficult to adopt technology because of the historical context or the cultural context that they are building. They are also heavily pressed for time. uh, you know, Today the doctor-patient ratio is abysmal in the country. One doctor for every about 2,000 patients or something like that, which is very very poor, which is almost double than what WHO recommends. So doctors don't have time to spend on trying to adopt new technologies, etc. So it is very important for us to build something that is, one, centered around doctors, plus secondly very very easy for them to adopt in their daily lives. And it has to happen if there is a improvement in their financial as well as clinical outcomes for these doctors. So being a having a doctor centric approach goes a long way in building this industry, or introducing technology in the industry, which is a myth, which is a kind of a myth busting fact, because there have been plenty of companies that have tried to go more of a B2C route in this industry, but and have spent a lot of money, a lot of cash, because of this approach. Um, but healthcare, if you want to build it in a sustainable and scalable way, should not be involving a lot of cash burn. So that is something that we at Navya have been very cognizant of. We've been building something that is very very doctor focused, with very very low cost of customer acquisition, and that I believe has really put us in a good stead. So that's a just a bit about the industry. Of course, there's much more that we can get into, but I think that will be a conversation unto itself.
Yeah. So I was actually going to ask you about that only. So, like, what marketing strategy do you really follow to get the most out of the business?
So we primarily work on a B2B marketing strategy, and our core users, essentially, like I've mentioned, are the doctors. So we want to get more and more doctors to use the platform. And the way we have gone about it is a kind of a two-pronged approach. We have partnered um, with companies that have networks of doctors in place. So these are larger healthcare enterprises or pharma companies and so on, who are sort of like doctor network lead generators for us. So we've received a bunch of leads from them. The second way we've done it, and this is more recently, about 50% of our doctors have come through a digital marketing strategy. So we are kind of pioneering a very unique digital marketing approach in trying to reach out doctors, which no other company has till now done. Most of the companies have kind of focused on a very feet on street model, which we have tried to stay away from. We're following a direct to doctor digital marketing approach. And of course, being a very close knit community, doctors are very good in referral programs. So our users actively recommend the product to their colleagues and friends, uh, if they see value in it, which most of the doctors end up doing. So we get a lot of referrals and recommendations on the basis of that. So we believe that those are the 2-3 things that have helped us grow our user base considerably.
Great. So, like, what are the future plannings with Navia Life? Are there more products that you're going to add on into this?
uh, we're actively, from a future perspective, we are actively looking to increase our doctor base. That is primarily our focus. So from about 20,000 odd doctors that we have today, we plan to increase it to about 10 times in the next 12 to 24 months. Uh, More from a product perspective, we have a very very highly accepted product now, from a point of view of our core digitization platform. So we plan to scale that up considerably. From a point of view of BNPL, that is a core focus for the next few months for us, because that is something that has a lot of potential in a credit starved nation such as India, and people haven't been able to build a good credit product in OPD healthcare specifically, which is a direction which we are thinking of going. So we plan to build the OPD, this BNPL product considerably over the next 6 to 12 months, hoping to reach about 100 million in GMV over the next 8 to 12 months.
So, what advice will you give to a person who is starting their career in this domain, especially like in the medtech startup?
Um, well, like any other business, I think the core focus has to be what is the problem that you're able to solve. Of course, there are a bunch of problems in the Indian healthcare space that need to be solved, but you have to also be cognizant whether there is enough scale and the ability for people to pay for that problem to be solved. So anybody who's starting off a venture in the space needs to be very cognizant of who's able to pay. Indian healthcare by itself is a very very large problem. Very very large industry. We have, I think, $200 billion worth of transactions every year. That's a huge market. But how many entities within the industry actually have the ability to pay for problems to be solved? That is a big question. So you have to really understand what your core solution is and who's able to pay for that. So that's kind of advice number one. Second, I think looking at trying to charge doctors is a bad idea. I think they are very uh, hesitant to pay for services. So that's something that one needs to also keep in mind. And secondly, B2C is a very high cash burn business, so to kind of be cognizant of that as well. So those are two three things that I can, broadly think of the top of my head.
Great. I guess with this, we can wrap up today's session. Thank you so much, sir, for joining us and sharing
Yep.
your journey and about your product. And to all the listeners, thank you for staying up and listening to our podcast. And stay tuned because we're going to come up with many more videos like this. Have a good day.
Thank you.
Thank you.